looked on that number, it goes up, it goes down, it goes up. We have 15 individuals now that are hospitalized between the ages of 2-month-old and 90. We have 6 adults in ICU and 1 in pediatric ICU. This is affecting us a little bit different than you've seen overseas because it was usually 60 and up. This is hitting a younger population for whatever reason here versus other places, and I cannot tell you why. This virus is affecting individuals in all age groups, and it's vitally important for the public to understand this. We've been telling you to stay home, stay 6 feet apart, wash your hands, cough into your arm, and stay home and self-isolate for good reasons, to slow the spread down, to make sure that we're being good New Yorkers, to make sure we're being good neighbors, and to make sure the hospitals don't get overwhelmed. There's a reason why we've been telling people this. So please practice the guidelines we've discussed, and you can look on our website to see online a bunch of other things that you should be doing. But what's it mean here in Albany County with all the new numbers? Overall, 9% hospitalization rate for those who have been tested positive. And if you look at the, put up the graph, if you can put up the graph for me. Steadily, since this started March 12th to today, you can see the numbers have climbed, correct? And the problem is the testing has pretty much come to a halt other than necessities. So I don't want people to think out there when, you know, and obviously these numbers are going to continue to grow in different areas, but that's really our number because it's probably much higher than that because our testing, because of test kits, and I call on the governor and the federal government to get us the test kits so we can continue to move forward, which I have been working on. I want to thank Steve Aquario from NISAC and all the county executives I talked to last night till 1 o'clock in the morning in sharing ideas of how we can do testing going forward and kind of bonding together in a partnership to help each other's counties out. So I want to thank you for being on the phone last night and the great ideas about testing going forward and what they're doing in Ulster County and other counties to continue testing sites going on for a variety of reasons. People, it's here. I've said this every day now. Take a step back, take a deep breath. It's here. Don't assume it's not here. It doesn't matter if that number drops, goes up, goes sideways, it's here. And the more precaution that we take, the more we stay home and away from everybody and do 6 feet of separation, we're going to slow this down and we're going to get through this. But we're only going to do this if we do it together. And the only way we're going to be able to do it together is by practicing this. We announced yesterday the Victory Bible Church at 21 Hackett Boulevard in Albany on March 15th, the 12:30 and 2 p.m. Masses to stay home under precautionary quarantine. We're trying to chase everyone down, but you can call us and let us know if you're at them masses. We're putting it out to the media because it's getting harder to track people down. So we want people to be aware of that. Again, if you have signs and symptoms, you know, we're still in the flu season, keep that in mind, and you know, call your doctor. Try not to crowd the ERs at hospitals, and you know, get guidance from your doctor on what you should do. I also want to thank working within a partnership with the Regional Food Bank of Northeastern New York to get boxes and food delivery to quarantined individuals starting early next week. We're working on that. So we are going to make sure we have food lines set up so that we can get food out to the people that can't get out, that can't shop. We've been working in partnership with all the different agencies in Albany County because so many nonprofits have stepped up. I can't thank you enough on that. So again, thank you so much for what you're doing. One of the things we got to keep in mind, right? And you know, people are getting anxious. It's out there. People are losing their jobs. Businesses are suffering. Possibly even going under. The jobless claims in New York in the United States just hit 3.3 million, and about a month ago, I remember talking about the unemployment rate being the lowest in history, and now we're at 3.3 million. So we have to keep that in mind. It's getting harder to get claims because the systems are being overloaded, and we want to make sure that we're working with people to continue to get the money that they need, or if they're having an issue getting money, to get food on their table and help each other out. I also want to remind everyone, and I have Dr. Giordano here to talk a little bit when Dr. Whalen's done, about mental health. And that's why I set that up day 2 into this operation, because again, it's just not emergency workers that need to reach out, it's going to be people in general. And I encourage you to call, and I can't thank Dr. Giordano and his staff for manning these phones from 8 a.m. to 5 p.m. 7 days a week. And the number again, it's 518-269-6634. 518-269-6634. And listen, don't be afraid to call, pick up the phone, and ask any question, even if you're just having a little anxiety. We're there for you. Also look at our videos online. We're doing different things, arts and crafts for the kids, putting workout videos. You're going to have a video later from Dr. Giordano and the staff about mental health. And if anybody out there has any suggestions, send it to us and we'll get it out there. You got a video and it's appropriate, we'll put it out there on our station to get it out there to the people. I especially want to thank the school districts. We've been working with them. And not only did Gillen School District step up, North Colony, Burnox, Westerlo, and Bethlehem Central School District with all their supplies that they had laying around. Thank you, thank you, thank you. It's going to get to the people that needs it, and I can't thank you enough. And again, the goodwill of this county makes me so proud to represent it, and I can't thank the people enough for that. Also, the American Red Cross, you saw it on the media last night, they do need blood, people are donating. I can't thank you enough for that. That's very important. And don't forget to go to our video. It's Albany County Cares at albanycounty.gov. And the New York State hotline, again, I keep putting it out there, 1-888-364-3065. And listen, I just want to remind everyone, it's a new day, it's a new era. Take a deep breath. We're all going to get through this. We're good New Yorkers. And if you look at the capital region, there's about 1 million of us here living in the capital region. And I can't thank my counterparts enough in Rensselaer County, Schenectady especially, Saratoga. We're all working together. And the more we work together and come together as a community, we're going to get through this. So again, I want to thank everyone. And please keep your comments coming into my office if you need anything. We're answering the questions that we can. We're putting the stats out there. Yes, the 166 will change. People will come off of that. The number does stay that because that's how many people we had with 166. Yes, there's people that do the math after the 14 days, or even if they isolate for 21 days, they will come. That number we could say could shrink, but they're infected, and this is a new disease, and we're saying that, hey, they shouldn't be able to get it again for a year. Can they carry it? There's so much guidelines out there. Look at the CDC. But just because you had it and you recovered doesn't mean you can go out in public. Doesn't mean that you can go out around people. Be courteous to the people around you. But again, I want to thank everyone for their comments and their input to my office, and especially all the elected officials and Mayor McNulty Ryan from Green Island, who's been phenomenal, Paul Mahan that called me, and Kathy Sheen. I could just go down the list. But I do want to turn it over to Dr. Whalen before we get to Dr. Giordano. Dr. Whalen.
Thank you, County Executive McCoy. So as just reported, we did get additional cases overnight, and we're starting to see the numbers of the additional cases go back up to what we were getting when we were doing widespread testing in the public. The fact that we are not doing widespread testing in the public is a concern that these numbers are as high as they are, because we know that these numbers at this point reflect positive either healthcare workers or inpatients. I will continue to advocate for community-based testing. In places where containment has been effective, there are 2 pillars to this: community mitigation and widespread testing. We need to do widespread testing so that our mitigation strategies are more effective. Without that, we can continue to encourage people to stay home, and we do continue to do that. But the testing is a piece that we really need to consider how we can implement. We need to get tests. We need to get tests, and we need to be able to do widespread testing in the public. I will continue to try to explore ways that we can make this happen. The county has my commitment to that, and I know the county executive is also very committed to finding out how we can do this. And we are exploring alternatives very actively at the moment, but we need test kits. We are hearing about widespread age range of individuals that are hospitalized. As the county executive said, the youngest patient is 2 months old and the oldest is 99. So this is occurring across age range. We have patients that are hospitalized in the intensive care unit and patients that have been in the intensive care unit that have stepped down and done better. As of yet, we have had no deaths reported in Albany County. We continue to monitor this data on a daily basis. We continue to work with all community partners to try to stem the spread across all sectors of the community and across all sectors of the county. We appreciate all of your input so that we can continue to educate the public. As I said yesterday, we are looking at what's happening in New York. It is just down the road. We are not far behind. We are not far behind. Our hospitals at this moment, I'm in touch with Albany Medical Center, who is on a call every morning with the local hospitals, and I'm reassured at this point that we still have a good supply of hospital beds, a good supply of available ICU units, and a good supply of available ventilators. But again, when we look to our downstate partners and when we look at how this has rolled out in other areas, we know we may not be in this position for long, and we are actively planning for the surge that we do anticipate. We will continue to do this, and we continue to ask the public to do their part. I think County Executive McCoy started off early in these conferences talking about pick 3 people you love and try to think about how you want to prevent them from contracting COVID-19. And I would echo that, but I would also say that, you know, consider what would happen if someone that you have a close relationship to, who might not do as well clinically as you might, would contract COVID-19. When patients are admitted to the hospital, they are placed under strict infection precautions, which means no visitors, which means they are in the hospital room with the individuals that are responsible for providing care for them. So when you think of those 3 individuals, think about that potential situation that you could be putting them into, and please heed the advice to stay home, to continue to practice hand hygiene, to cover your cough, and to really limit interactions at this point. Thank you.
Thank you. Dr. Giordano.
Good morning, everybody. Thank you, County Executive McCoy. I'm very grateful for the opportunity to talk with you this morning. As you've been hearing Dr. Whalen and the County Executive talking for many days now about the importance of mental health and emotional well-being, there's a reason for that, because our physical health depends so much on our emotional well-being, and our immune system depends so much on our emotional well-being. So I welcome the opportunity to bring to you a couple of brief messages this morning. One, I want you to know that the Department of Mental Health is operational. We serve about almost 1,000 mentally ill individuals in our clinic, in our jail, in our mobile crisis team, in our community. Our doctors, nurses, nurse practitioners, social workers, support workers, they are coming to work, and they are working on the front lines of the mental health side of this crisis. So I know I speak for the County Executive and for Dr. Whalen when I thank those professionals who are struggling just like everyone else with this, but also serving the residents of this county. In addition, as the County Executive mentioned, we set up a mental health support line, and the number we've given out many times, 518-269-6634. We've had almost 60 people call into this line. We have volunteers and staff members manning it 7 days a week. I would just say that it's a mental health support line, and although we'll handle anything that comes in, we have had to direct a few calls to other sources. We're not medical doctors, we're not health advisors, and we're not a complaint bureau. But we've handled innumerable mental health related concerns, and we will continue to do that. We also have always had a psychiatric crisis line, which I just want to remind you of. The difference is there's a lot of folks, me included, who is anxious and worried, as many of you are. The mental health support line is there for you. But for the folks with mental illness, we have always had a psychiatric emergency line, and we continue to do that. That number is 518-549-6500. So just a shout out to all the folks at the Department of Mental Health who are working so hard. This is unprecedented times. The main, I think, challenge for us from a mental health standpoint is dealing with uncertainty. And we're dealing with prolonged uncertainty. And if you weren't predisposed to have anxiety, worry, or stress before, or if you weren't suffering from mental illness before, I think that, as probably most of you in this room would attest to, the anxiety and the worry is affecting all of us. So I'm here to offer some other suggestions about what we can do to try to mitigate those things. In a world of uncertainty where we're feeling like we're losing control, the recommendation, and you've heard this from the county executive and from Dr. Whalen, take control of what you can. And when you can't take control of certain things, then it's about managing your emotions. So let's just talk briefly about both of those things. Taking control of what you can in your everyday life, making plans, developing routines, creating family rituals, sticking to those. There are things every day that we can control, and we should. There's an old adage that it doesn't matter what happens to us in life, it matters how we respond to that. This is our challenge. You can take control of things, and we need to. The managing emotions parts is a little bit more difficult, but the intuition and common sense that we all have is what we bring to bear here. There are some basic things that we all have to be reminded of. Exercise heals us emotionally. Exercise, walking, nature hikes, these are things that we can all do now. For so often we've heard people say, you don't have time to do things. Now you have the time to do those things. Exercise is critical. Sleep is critical to the immune system. You've heard that many times, and so is eating. So those three things are very helpful to managing your emotions. I would recommend, however, that you also take advantage of the many self-help opportunities that are out there. I would download a meditation app. I've done it, and I recommend it to my patients and to the people we work with. If your mind is focused on the future, you're going to have anxiety. If your mind is focused on the past, you're likely to have other emotional problems, depression being one of them. Meditation and the self-help techniques that are out there and available, and everyone should take avail of these, helps people focus on the present moment, take care of what you can, and take care of yourself. All of these things add up to an emotional state that is ready and able to respond. And as I said before, that will impact your immune system positively. Two other things. There are at least two populations that are going to need extra attention. The elderly is one. We've been working on in Albany County, isolation and the depression that's associated with that. This is now even worse because some people have to be isolated because of quarantine. Reach out to your neighbors, talk to the elderly folks in your family. Make sure that you're working on connecting with them more than ever. I've spoken many times about the ills of social media, and I probably will again when this is all over, but now thank God for social media. And I would encourage all of you to make sure your family's hooked up and those elderly folks that need to be connected, connect with them. The other population that is very challenging from a mental health standpoint is children. And I think it's up to us as adults to model for them the way to react. Reassuring them, helping them feel safe, modeling confidence, answering the questions that they ask. You don't have to elaborate. You don't have to, in court they always tell us, only answer the question that's been asked. Well, I would say that with our children also. Make sure you listen to them, answer their questions, and make them feel safe. Lastly, a recommendation for all of us, and with all due respect to our friends in the media here today, I think we have to pace ourselves, and we have to pace ourselves watching the endless coverage of this. The uncertainty is going to go on for a long time. The stress is going to go on for a long time. You probably only need to check the media maybe once or twice a day instead of watching it all day. And lastly, the world is still a beautiful place. And I'm encouraging my staff and the people we work with to remember those positive elements in our daily life. More than ever now, I think we're going to be defined by how we treat one another. Kindness, generosity, compassion, empathy, those are still the coin of the day. And I would encourage you all to take that advice. And I'm grateful that our county has recognized the fact that mental health and emotional well-being is critical to getting us through this. So thank you, County Executive.
Thank you, Dr. G. I do also want to thank the Chair of the Legislature, the Majority Leader, Minority Leader, and all the legislators that have been working with us, reaching out and working with my office. And Dr. G's right. Listen, how many people in this room are watching this, been in a fight with a sibling, a friend, and you can't even remember what the argument was over and you haven't talked to them? It's time to move on, move into the present and forget about that, and come together as a family unit, come together as friends, and continue to move forward. So that's why I'm going to say today, I forgive my mother and mother-in-law for trying to go out. So I'm going to get past that, and I'm going to move forward. So you two got a parlay. But any questions?
Hey, Dan, the mayor, first of all, of Boston, and then now the governor over there in Massachusetts, they banned the use of reusable shopping bags in stores and supermarkets in the interest of eliminating that possible source of COVID-19 transmission, allowing plastic temporarily to come back in. Anything like that, on your agenda?
We pushed that up to the governor's office. I'll say to everyone, I know it's the law, but right now I would heed to that. I'd go back to plastic and not use your bags, not unless you're cleaning them and you're disinfecting them. But if you're not, leave them at home. I totally agree with you. Right now is the time to suspend that law, but I can't do that now, so I'm waiting on the governor's office to see what they're going to do. But I wouldn't recommend anyone to use their reusable bags, not unless you're cleaning and disinfecting them.
Dr. Whalen, can you talk about the 2-month-old? When you have such a range here, what kind of condition? Is that the patient that's in the pediatric ICU, as Dan said?
So I'm not going to talk about patient specifics. I think that, the mic, yeah. I'm not going to talk about individual cases just to protect their rights. There are individuals that are hospitalized, and there are it's just as we have patients across the age spectrum, we have patients across the clinical presentation spectrum. The vast majority of cases that have been previously diagnosed when we were doing widespread community testing, as we know, had had illness that did not require hospitalization. I won't say it's very mild, because a lot of people had something that was akin to a bad flu, and in a small percentage, 20 to 30% of people, they did have very mild illness. So we know that there is a huge clinical spectrum with this illness, and we don't know exactly, other than our vulnerable populations like the elderly and those with immune compromise, we don't know why some people don't respond as well as others do. So, as County Executive McCoy said, we are starting to see in the United States the epidemiology be a little bit different than what we saw in China and other places. When we were first starting to learn from how this outbreak emerged in Asia, we were again giving the message again and again, if you're young, this isn't going to affect you, you're not going to be that sick, just protect people that are older and immune compromised. This is not how it's played out in this country. We have had younger individuals that have had more serious illness. So we, again, want to tell younger people that it is as important to prevent themselves from exposure and illness. Not only that they could get serious illness themselves, but that they could transmit it to others that we know are in high-risk categories. So that's a very vague answer to your question, but without commenting on individual cases.
And you talked a bit about how you want to see community testing ramp back up. Is the sticking point that the hospitals don't have the supplies? Is that what's really holding it up?
The kits are the sticking point. I know that there's also concern as we're ramping up around PPE that's necessary to do the testing. But, both of these things are the main concerns here in Albany County.
Do you know where hospitals stand on PPE? I mean, you said that they're, as far as beds and ICUs, that we're in good shape, but do they have enough?
I think that we are continuing to coordinate requests for increased PPE. I have not heard of anyone that is currently experiencing a critical shortage, but I know that they're monitoring that on a daily basis and trying to be very proactive with their planning and requesting.
Dan, with Shaker Place, we got a tip about there being people under quarantine there. Where do you stand with the nursing home?
Nursing home has been locked down since before I started my first conference. We're looking at everything. We're treating our nursing home like we treat any hospital. Like St. Peter's is locked down for the same reason. So we're making sure we take care of our most vulnerable population, and that's our seniors. Anyone else? Yes, sir.
You guys mentioned that the county's not reported any deaths related to this disease, but people certainly have died, I'm assuming, from flus or other respiratory illnesses since then. With the lack of test kits, is it possible that we have had deaths from COVID-19 that we just aren't counting?
It's a question you can't really answer. It's a great question, but till the autopsies are done and get tested, we couldn't answer one way or another.
But we can't test right now.
Correct.
Dr. Millen, with the positives we got today, I know a few days ago we said we're probably still seeing ones that were from community testing. At this point, are those positive cases either in patients or healthcare workers?
Yes.
And that's why I put the graph up, to show people that are watching this that that number would be much higher if we were still doing community testing. So it is out there. It's all around you. Just be careful. 6 feet of separation. Deep breaths. We're going to get through this, like Dr. G said. Look at the video, and we're great New Yorkers, and I love the Capital Region, and we're all working together. So stay calm, stay focused, and continue to take the proper PPE steps, when you're out there, and keep 6 feet of separation. Wash your hands constantly, and do what's right. So, any other questions? Yes, sir.
Yesterday, you guys put out the advisory about Victory Bible Church.
Correct.
But you have said that you have not put out maps from other regions where you have spotted infections. Can you help us understand the decision making as to when you put out a call for to let people know that they've been in a spot where people have been infected and when you don't?
We have worked with the EMS community throughout, through Sheriff Apple's office. They have a list of everyone that is on the mandatory and precautionary list. That goes out daily to all them. We brief the local officials what's going on. And again, it takes time to map and track everyone that might have been there. And, just in case we missed anyone, we thought it was a good idea to put out, if you're, just like we did with the 2 churches a couple days ago, that if you happen to be at that mass and they didn't see you, that they would know enough to maybe just call the health department or just pre-isolate, self-contain themselves for a while. That's what we're asking.
And again, that information would come to us from the extensive interview that's done with the case by our nursing staff. So anytime there is a positive case, we reach out to the indexed patient and say, where have you been? And so that whenever there's an organization or a school or a place of business, we go into a lot of detail with them. And we always inform the business, the school, the church, so that they can implement processes like deep cleaning if they want to close, to do that, and so that we can identify who within that business this individual had close contact with. If it's something like a school or a church, it's often difficult to say. So, in those situations, it tends to be a little bit more broad, and that's where we get the larger scale outreach, community outreach.
Do you know right now how many
So I got news, I don't have a definite number, but the news that I got this morning was reassuring that there was likely a very small amount, and when I say very small amount, about 10 people may have been exposed. So that was reassuring. In other situations, like we had at Farnsworth, there was a much higher number of individuals that could have been exposed. This does not look to be a large-scale exposure at this point.
Yes.
Yesterday, Rensselaer County and Sarasota County called for quarantines for anyone visiting outside of Westchester, New York City. Obviously, that would be really difficult in Albany County. You guys don't have any plans to join that call, do you?
It's, we're calling on the governor. I think he's doing what's he thinks best for New York State, and, we went